on whether the final product really met the criteria about and the concerns that I was hearing from the families and businesses in my district.
Was your office getting flooded with phone calls, letters, emails, that sort of thing?
Oh, sure. I mean, we always do whenever there's important legislation, but this healthcare is so personal and it really affects people's lives that it definitely had a lot of questions, a lot of comments, a lot of input.
And did any of that influence you?
It always does, but it's, you know, healthcare has been one of the #1 topics on the minds of the people I represent since I came to Congress. You know, you always get some people who show up at the very end, but all the way through for 6 years we've been hearing about the rising costs and how the reason we've seen the pool of insured shrink is because too many people haven't been able to keep up with those costs, and now they'll have more choices and affordable access.
Before you came on, Dane and I were talking about the bill and just the sheer volume of it, and we were saying, how many people do you think out there really understand what's in the bill?
I think there's a lot of confusion out there, and that's why I'm glad to come out, and I think a lot of us will be going into our districts and really helping people better understand what's in it. Particularly small businesses think that somehow this is going to penalize them, but businesses of less than 50 employees aren't in any way required to do anything or penalized in any way.
Not at all, because I want to share just an anecdote with you. One of your constituents, he owns a diner, and he's a cancer survivor, and so in some ways I thought he would think this is great because he couldn't be cut out from any insurance policy. But I asked him what he thought about this. He's a Democrat. He said, I don't like it because I'm a small business owner and I think I'm going to have to now pay health care for all these people. You're saying no? No.
In fact, if he's under 25 employees and average incomes are at the right average, he'll be eligible for tax credits and get up to 35% of what he's already paying if he does have insurance back in a rebate. If he doesn't have insurance, he'll get 35% of his portion of what he's contributing for his employees' coverage.
How do you think this is going to play politically? As you know, your opponent in your upcoming congressional general election is already hammering at you with this health care vote. Do you think this is some Democrats could lose their seats over this?
Well, you know, when you're voting on something as important to the people that you represent, you're really not thinking about November. You're thinking about when are the reforms going to roll out? What are we going to do to make sure with these new reforms that people won't be dropped? One of the things that a lot of people don't understand is this is not just for the 24 million Americans who don't have access. It's for all the people who do. 87% of Americans have insurance they like, but they can get dropped at any time. Pre-existing conditions can preclude them, and lifetime caps can drive them into bankruptcy. These reforms will affect everyone who has insurance in a really positive way.
As much as you like this bill, why was there no malpractice tort reform for doctors?
There actually is an ability for states to create tort changes.
But that's a pilot program, isn't it? I mean,
no, there's actually available funds and grants for peer review so that doctors can review whether suits have merit. That's already in there, and there's the ability for other types of innovative approaches that can be used.
Getting back to the campaign issue, though, do you think Republicans help themselves or hurt themselves by not putting a single vote on this bill?
Well, I think we'll leave that to the pundits and, more importantly, to the voters once they realize that they now will have a higher level of health care security. And I guarantee that in the past having coverage didn't give you security. Now you'll have that. And for those who don't have insurance, they'll have affordable access and choices.
But it sounds like you're quite comfortable if you are targeted by Republicans because of this vote.
Well, I'm very comfortable that my vote supported legislation that's going to measurably help the constituents that I work for every day.
What are the other misperceptions? We mentioned small businesses. What else are you hearing from your constituents where you have to say to them, no, that's not in the bill, or it doesn't work that way?
There's a lot of confusions about penalties that really don't apply for small businesses. They don't realize that there's tax credits available to them. A lot of people, again, who have insurance say, well, why am I going to help pay for something that someone else doesn't have when I have it? But they don't realize whether you're a small business, you're one healthcare crisis away from being dropped, or an individual whose child might have a pre-existing condition, that child is immediately going to get coverage. No more pre-existing conditions, and adults will be fully brought in by 2014.
We had the head of the Chicago Medical Society on the other night. He said that there could be a logjam for people out there, especially in rural areas, now wanting to see primary care specialists. That they view, doctors do, that as being one of the weaknesses of this bill.
No, there actually is funding for training for primary care, so we expand positions, and there's assistance for clinics so that they'll have the ability to to double, the capacity that's likely in certain areas. So that's all accounted for. There's a lot of criticisms about the size of the bill, but this is a complex issue, and when you're changing statutes and you're requiring certain things that protect people, you need to think that through carefully, and those things were.
But the way you're talking now, there don't seem to be any shortcomings of this bill. I mean, even the president said it's not a perfect bill. I mean, certainly you see something wrong with this.
Well, when I had voted on the House bill, I had said at the time that I thought it got mostly where we needed to do in terms of affordability, portability, security, but at the same time I wanted to make sure we had better cost containment and cost curve containment, and this bill does that with $1.3 trillion of deficit reduction. So some of the things I had concerns about then have measurably improved, and that's what happens when you take a House and a Senate version and you bring the best of those different products. That diversity of opinion usually yields a better outcome.
And on Friday, on another subject, talk again in Washington of relief for people who find themselves underwater on their mortgage. Where is that going?
Well, we've been, as part of our Wall Street reforms that we're working on, and as you know, I'm on the Financial Services Committee, we have reforms coming there that will disallow the kind of mortgages that set people up to fail in the first place. We'll have banks oversight, derivatives oversight, capital requirements that will make people have more confidence about our financial system as a whole. But for those that are struggling, we do outreach and we tell people to call if they want to get connected to counselors.
Is there going to be money, though, a financial package for them?
For foreclosure folks?
Mm-hmm.
I don't know which proposal that is.
Okay.
I do know that there is counseling available to help people.
All right, Melissa, thank you very much for joining us this morning. Coming right off the plane from Washington. Appreciate it. Next up, a flurry of activity this past week in Springfield.
From overhauling the pension system to new restrictions on red light cameras. We're going to talk about those issues next with State Representative Jack Franks.
And we'll talk to a Chicago alderman upset with Mayor Daley's plan to reduce the number of city street sweepers. He says it's undercutting the city council's power.
Then later, former Governor Rod Blagojevich can have his portrait put up in the state capitol.